I, I've chosen a little bit different approach, and I hope that's okay, because my focus was, if you are in the early stages of starting an organization, what would be useful to know from those have been having an organization for a lot of years. So that has been my main focus. So our organization is 35 years this year, and I will try to come with some headlines of what I think would have been most important and maybe hopefully useful if you are in the early ages of an organization. So just wanted to show you a picture. This is from our 30th anniversary we had at Frambu. I'll tell you a little bit more about Frambu later. And this is the biggest group ever that we have been able to get together at the same time. So it was really nice to have this big gathering. Yes. Just some facts from Norway. It was the organization was established in 1986 at Frambu. Frambu is a resource center for many rare diseases in Norway. It's the biggest resource center. And I forgot in my presentation that I'm also seated at the board as a deputy chair at the board of Frambu, that National Resource Center. It contains more than 450 rare diseases, so it's not only Prader-Willi syndrome, but we are an active organization that is in close collaboration with Frambu, and that is also why we also get a lot of researchers out, because we are so active as an organization. So Frambu is arranging almost every second year 1 week for PWS families. You can apply and see if you can come in. There are not there are room for 11 families, and then you can stay for 1 week. There are a lot of education from doctors and different professionals. The siblings are in groups and go to school, and all of the PWS are going either to kindergarten or to school, and also have group and education. So it's a very big and good resource. We are very lucky to have this opportunity in Norway. So just wanted to tell that. So at one of those weeks, it was established in 1986. Now we are containing the national organization has 435 members, 129 with PWS. We know of about 150, 160, I think, in Norway, but we have 129 included in our organization. I'm not going back to that, to the health, so much about the healthcare system in Norway, but I can tell you, because the growth hormone is such a big issue, a theme in the PWS world. So everyone in Norway is getting growth hormone for free, and also now it's almost a common for all the grown-ups to get the growth hormone. The members of our organization is those with PWS, their families, and some professionals, experts, and schools and kindergartens and group homes and so. The funding is from the membership fee, and also we have a big funding from the government. And no one is paid to work for the association, and everything is done voluntarily, as I assume is for most of the countries, I think. So how we started. We started at family with the first meeting for families with PWS. Parents decided to make a temporary board. It was just those parents that were attended at Frambu at that time that just decided to start the organization. After a while, a professional council was established. So it lies besides the board and give guidance. It started with activities regionally and then nationally. International contacts were established, and we have been a member of IPWSO, I think, almost the most of the time, I think. And Frambø as a resource center has been very important, as I said a little bit about. How we are organized. We have the board who is seated by parents. We have a general assembly every second year, and we always put that on a weekend, so we can also have a family gathering at the same time, and always invite some doctors or specialist experts to come and give speeches at that generally assembly weekend. We have that professional council, as I told you, that's seated by different doctors, dentists, psychologists, physical therapists, excuse my English, nutritionists, and it's also a close collaboration with Frambø Resource Centers. Several of those experts are working at Frambø, not everyone, but several of them. We are organized by regional peer person. I don't know if is peer person. Do you understand the word peer person? I just used Google Translate, but it's like parents being a peer for other parents. So we have that regionally. And they are arranging one weekend per year for the families in their region, and also have a national peer person for the youngest up to 6 years. We have that's a national peer person. So every time we have a new member, a little baby or family, it's they getting in early contact at once and starting to be to give information and answering questions, setting in contact with other peoples around them, with experts and so. And we also have a national peer persons for holiday weekend in Spain every second year. We arrange that every second year, and it's a teenager and the grown-ups. So for the last three times, me and my husband has been taking two groups to Spain, either Gran Canaria or to Mallorca. They go with they have to have support persons with them, and we arranged the week in the sun, and they just love it, and it's very fun and nice trips. And they have to pay, the organization is funding some of it, and they also have to pay a great amount for themselves. We have Facebook group, and we also have the PWS News magazine that comes out twice a year, in the summer and in December. That's a paper version, the PWS magazine. And especially the grown-ups really love the paper version, because we have been discussing doing everything digitally, but they say, no, we want the paper one. We want to see and look and have it. So yes. So what I think, if I should give some advice or share experience, if you are in the early ages of starting an organization, I think it's important to not complicate. It can be overwhelming comparing yourself to organization that has been going on for many years, building a lot of structure and network and everything, and it can be overwhelming. So I think I think that the most important things that these parents organizations or family organizations do is that people don't feel alone. I think that's the most important, both those with PWS to know other, to come in contact with other with Prader-Willi syndrome, for the parents to know other parents, for the siblings. I think that's the most important thing. Set people in contact with each other by telephone, FaceTime, Facebook. We didn't have that 35 years ago. Now we have a lot of new tools to get in contact. So we can use a lot of those digital platforms to get in contact if it's not possible to meet face to face. And the last 1.5 years, no one has been able to meet face to face, so it's very good with the digital ones. Then when you have start with a network by families, because when families are meeting together and just share experiences, it's very helpful. I think for many of us in our organization says that it's a really important thing to exchange experiences. And then you can build further with starting to include getting contact with expert resources to guide in the latest news, the science, and is willing to also invest in the organization, invest their time and resources to help the organization. And then I think it's important to know the national structures, guidelines, network, and how is this thing working in my country, and how are our country, now our organization, our diagnosis, how is that in our system? How can we use the system to our benefits? And then I think it's very good to be in contact and have a good network with other rare disease organizations in your country. We are a part of a national alliance here in Norway, and it has been really helpful, because if someone invent the wheel, we don't have to do it ourselves. We can learn from each other and how to do things. And so I think that's we have an experience that is very important. And also network and guidance from IPWSO, it has been very important for us in Norway. And in the presentation, you said that I was part of, it's called ENDO-ERN. It's an endocrinological group in a European reference network for rare diseases. So there are different international organization and resources that you can be included in. So just yes, that's one of them. So yes, and then start small and go step by step. Don't complicate things, and ask other countries, how did you do that? How can we do these things? We think this is a challenging. How did you do it? Be outgoing and asking questions. I think that is a good thing. And I just wanted to remind ourselves, yes, we are rare. Yes, we are small, but we should never, that should never stop us. Everything is possible. I just wanted to include a picture of my daughter, how she is standing on the latest drinking station when she attended a mountain bike ride on tandem bike. Now from there, and it's not just a downhill, it was 85 kilometers, and has been several years she has dreamed of doing that. I thought it was possible. Everyone thought it was impossible, but she never thought it was impossible. So she just did it. And so that is a mindset that we can include also. I try to be as her because she is so goal. She's setting goals and go for them. So and so could we do with our organization. So, okay, thank you for your attention.